right, everyone, come on into All Things Odd. I'm Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
And I'm Rebecca, audiology
And
resident.
we are going to start with our YouTube channel. I'll have Dr. Galloway talk about that.
Yes, so this is our YouTube channel. You can search our business name and you can subscribe, so then you'll get notifications about when we have a new episode. During the summer, there was quite a few weeks where we didn't have new episodes too. So if you want to go here to fill in on one, if we don't have a new one, you can look at the different topics. And now that we've been doing these for a while, there's a topic. I mean, there's a video on pretty much every audiology topic. So if you're have a question, you could go look and see if we've covered that topic.
Yeah. All right. So take that down here. Okay. So we have a really interesting topic today because first of all, it is World Breastfeeding Week. So sometimes we have some fun and we look at like what the national day of whatever is. This happened to be breastfeeding awareness. And so we wanted to kind of jump on the bandwagon a little bit and talk about how maybe breastfeeding can help with your auditory health. And so Rebecca did a great job. I'm going to give props to her because she did a lot of research to kind of get us prepped for this today. And we have some interesting topics. Again, just kind of looking at newborn hearing screening and just looking at hearing loss, I should say, with newborns. 50% of infants with hearing loss have risk factors for hearing loss, and it is important to try to get those babies screened, whether or not they get screened before birth or before they are discharged from the hospital, or even afterwards if they were missed, or now we have home births. It's really important because 1 out of 2 infants might have risk for hearing loss. So that's super important. So when we tie that into looking at does breastfeeding improve any hearing outcomes, that's what we kind of want to talk about today and take a look at that. And so I'm going to hand it over to Dr. Galloway to kind of talk a little bit about the research that we looked at to give you guys some good information about this.
Yes. So the study that Rebecca found, it's looking at breastfeeding and then also passing your newborn hearing screenings. So it's kind of interesting how they did it. And they were looking at babies that are breastfeeding actually at the breast versus having bottle fed in the first 48 hours of life. So all of these babies were full term, no other risk factors. They were all delivered vaginally. So they have a lot of similarities. They also had to be of a certain weight. So essentially they wanted a sample of, healthy babies to do this study. And then they were looking at the difference between the ones that were bottle feeding within the first 48 hours of life or breastfeeding. And the breastfeeding babies really did eat at the breast right before they did their hearing screening. When I was going through this yesterday, I was kind of looking at it and like picking at it, just to be like, why did they do this? Why did they do this? Because the difference in breastfeeding versus bottle feeding, I mean, they've only been eating for 48 hours, right? So it just seems like that's not very much time difference. I actually learned that some of the previous studies, they weren't doing it all at the same day of life. So it was kind of harder to compare. And so what they found is the babies that had eaten at the breast before they did their hearing screening were more likely to pass the hearing screening. Likely because, whenever they breastfeed, there's more negative pressure and it helps to clear their middle ear. So if they did have, fluid in there from birth or, just kind of things that were going to prevent them from passing, having that breastfeeding negative pressure is going to help clear that middle ear. So, they're going to be more likely to pass their hearing screening, which is important because we want to get the hearing screenings done before discharge. And so typically you're in the hospital for like 48 hours if it's a vaginal birth and 72 if it's a C-section. And so if we can't get those hearing screenings completed and we have to discharge, then the babies are going to have to go into like more of a private office or something and get that done. So that's what we know. I will also say that even babies that breastfeed, sometimes they don't have that down in the first 48 hours, or the mom is not producing breast milk in the first 48 hours. So it's like it's more method of feeding they were using in the first 48 hours of life rather than like how you're feeding them on the long term, if that makes sense.
Yeah, and as I'm listening to it too, like we had talked about it yesterday, I also think like if you're thinking like maybe it's the nutrients, right, of the breast milk, but I'm almost thinking that it's got to be a lot to do with the sucking action as well as the position of the head. And so I know that a lot of times, and we're not saying just to kind of do a disclaimer, we're not saying, oh, breastfeed over bottle feed. This is not what this is about. But I'm just wondering, even if you were to angle the baby a certain way in the crook of your arm with the head right there, maybe it's just a little bit different bottle fed versus breastfeeding. With the angle of the head, I'm thinking, you know, like what you said with the middle ear clearing. If you think about the baby being in a fluid sac, right? And then also it's easy for fluid to get into the nose behind the eardrum, which was that eustachian tube. I'm just thinking of all possible things of why just a little bit of an angle would be different because we're not really looking at nutrients because like you said, within 48 hours, you might not necessarily have.
Well, and I think too, it's if you, especially the newborn bottles, like if you just hold one upside down, it will just drip milk. You don't really even have to suck on it very hard. So they were kind of hitting on that actually breastfeeding is just more negative pressure than sucking out of a bottle. So I think that explains the results. And yes, that being said, I did breastfeed my kids, but neither one of them were doing that consistently at 48 hours. So at first, that's what I was kind of confused about with the study is, well, how did, you know, they're not even established feeding. They haven't really even established their like feeding habits yet. They did reference another study and they used it in their lit review that had linked more congenital hearing loss to babies that were not breastfed. And I didn't read that whole study, but I already have problems with it because of the way that it was done. And they did it retrospectively and it was not done in the United States. Not that that's bad, but I think the culture is different surrounding it here. So that one, I don't necessarily think that whether you breastfeed or bottle feed or formula or whatever, it's going to affect the rate of congenital hearing loss because that is something that would have happened in the womb while you were developing with your development. It doesn't have anything to do with what you eat after you're already born. But then, you know, talking about socioeconomic factors and all of that, you know, women that are more educated and have more money are more likely to breastfeed. And so it's like, what else does that, you know, introduce into your parenting repertoire?
Right.
But so I think the more important thing is that we're able to test the babies before discharge using this kind of 48-hour model. And of course, all babies are different and all moms are different. I was talking to Rebecca about, you know, the first time versus the second time. My first kid, I didn't know what I was doing. The baby didn't know what they were doing. It was new for everybody. But the second time, I had already done that before. So I would have, you know, second time moms would probably be more well-versed in, okay, we can get this started, you know, while we're still in that 48-hour period. But yeah, it's not the nutrients. It's more just the power, the sucking power and the difference in the negative pressure and the sucking patterns.
Yeah. Yeah. And honestly, like if we're looking at numbers, the results of this study that we were looking at that Rebecca had found, basically, you know, this was based on transient evoked otoacoustic emissions. So for the audiologists that are tuning in, so TEOAEs, again, pass or fail based on if the otoacoustic emission was greater than 6 decibels. And numbers wise, like they're looking at, they did 73% that came of the sample that were breastfed, 27 were formula fed. And then the fail rate was 7% of breastfed infants failed the screening versus 9.7% of formula fed. So not a whole huge difference to say, oh, okay, well, breastfeeding really like reduces the effect, but it's enough, right? Where they're saying that this is something to just kind of pay attention to. Also, it says that breastfed infants required fewer retests, potentially reducing the anxiety and the follow-up loss that can come from parents not being able to bring their kids back in. So number-wise, I mean, it's okay, you know, but it was something enough to be published for sure.
Yeah, I to be honest, I don't like the title of the article, because the title is, and I was looking on PubMed, on it's NIH that did the study, breastfeeding results in better hearing in newborns compared to bottle feeding. That's the title. I feel like that implies something different than what the study is actually telling us. And I do think there's sensationalized headlines, and there's people that are like really pro breastfeeding, and people that are like really pro bottle feeding. But I thought that the title was a little bit misleading. I think it's more of like the method and how we're eating in the first 48 hours of life affects if we're going to pass our screening or not.
Yeah.
But the lit review was very interesting. There's all kinds of different studies about middle ear issues in babies that are bottle fed versus breastfed. So they had some different statistics of, in the first month of life, how likely they were to have had an ear infection versus 6 months of life. And the breastfed babies were a lot less likely to have middle ear infections. But again, it's more how you're eating it, less what food it is. Because they found that if you put the breast milk in bottles, which a lot of working mothers do, you're pumping at work and then you're putting it in a bottle, you have the same likelihood of having middle ear infections. So it's not like magic, it's just how you're feeding them. So
yeah. Okay, so then we'll kind of, we're going to bring Rebecca into the conversation here, and we'll talk a little bit more about just audiological benefits of breastfeeding. I'm just kind of looking at it, like stepping back a little bit based on some of the things that we've been reading and talking about.
Oh my God, there we go. I think just as an audiologist, and there's always benefits to us having this information. And I think one of the biggest one is just kind of collaborating with early infant care teams and just getting an idea of kind of that interdisciplinary aspect of getting nurses and audiologists kind of on the same page of understanding how hearing health is impacted by some of these things that may not be understood. I think that's a good way to look at our role as audiologists, and maybe getting out to first responders isn't the right word, but the first people who are interacting with moms and babies, because it's not usually us that are in the hospital setting. It's usually our nurses or nursing assistants that are in there helping new moms. So just kind of getting this information out there. And so that's kind of what I looked at it, is just more of the educational aspect and kind of looking at how can we cross the divide, so to speak, through our different practices. One of the other benefits that I like too is just kind of looking at long-term benefits of getting children screened, and if middle ear infections are something that's a part of, is just understanding the importance of kind of getting them screened early. And if, like you said, if they're doing home births or things like that, don't skip it. It's important, especially if maybe breastfeeding isn't an option for you too, or if you're one of the higher risk categories. I think that's really important. So just by kind of looking at, the topic of breastfeeding and hearing, I think these are some things that I gleaned from this week and kind of looking at this topic.
Yeah. I think that some of the, again, going back to numbers too, of what you found too, I thought was interesting, was what Dr. Galloway was talking about too, just lower incidence of otitis media or ear infections, up to 17% reduction with 6 months of breastfeeding as well. Again, what we're finding out is maybe not so much the nutrients, but just the action, the angle of the head, whatever it is. There were improved tympanograms, are basically like how the eardrum is moving back and forth, maybe less use of antibiotics. And I like what you said, Rebecca, about just more collaboration. And so just an audiologist's role can be, talking or collaborating more with pediatricians, lactation specialists, or consultants, things like what you were saying as well. So definitely, just if you're an audiologist watching this, just kind of be a little bit more aware of research that has been published and that's out there, but also kind of be more of an advocate to be able to collaborate with people that are in the lives of moms and or parents and their newborns as well, and try to really push that, get that hearing screening, kind of consider just keeping an eye on ear infections. Again, Sometimes ear infections in kids are hard to identify. And so if there is tugging at the ear, maybe the ear feels red or hot, maybe if your child has a fever, just kind of bring them into an audiologist to see. We can easily do a quick test to see if the eardrum is moving back and forth. If you're, this is what something that I learned. If your child is sniffly a lot, I remember when I had my daughter who had multiple ear infections, I knew that the minute she sniffled, I was literally on top of her, suctioning that out of her nose, because I knew as an audiologist, things that were in the sinus passages, especially for kids, their eustachian tube is more vertical, and then it kind of drops a little bit here, or I'm sorry, horizontal, and then it drops a little more, that anything in the nose can get into that middle ear section and cause an ear infection or fluid in the ear. And so I'm just kind of being a little more aware of if your child is more sniffly, just kind of pay attention to that as well, because that can lead to fluid in the ear. I'm not going to say ear infection, but just fluid in the middle ear section. But yeah, so any other thoughts about just World Breastfeeding Week, as well as what we can do as audiologists?
I think that one thing that maybe was an unexpected learning opportunity from this is just when we see patients from follow-up screens, they didn't pass their screen in the hospital and the parent is a little bit panicked about that. This gives us some numbers, or also, to ask, maybe they are not breastfeeding or can't breastfeed for whatever reason, just to be able to tell them that there's more likelihood that they won't pass, not because they have permanent hearing loss, but because that middle ear just doesn't get kind of cleaned out the same way. Or like for labor and delivery nurses to know, okay, we might be more likely to get a referrer on this screening because of, XYZ, like to just kind of make patients feel better, but also just have more information about, who passes and how many people don't pass on the first round and all of those things.
Yeah. Yep. All right. If you're watching and you have any other comments or questions, put them in the comments either on Facebook, Instagram, or YouTube, or even on my LinkedIn, as that's where we're streaming as well. And we will be back next week with another episode and a new topic. So thanks for tuning in.
Bye.